In this video, we're going to talk about a very common condition in older cats, chronic kidney disease. We're going to cover why it happens and how to diagnose it. And then later, we will also discuss the prognosis for cats diagnosed with chronic kidney disease. I will cover the treatment options for chronic kidney disease in another video. Chronic kidney disease occurs in a huge percentage of older cats, usually from the age of about 12 years onwards. Less commonly, it can also occur in younger cats. For most cats, we do not know why they develop this condition, but gradually over time, the cells of the kidney, which are called nephrons, stop working little by little. When chronic kidney disease occurs in younger cats, it can be as a result of a genetic abnormality of the kidneys or due to kidney damage when they were younger as a result of poisoning, quite often from the lily plant. Chronic kidney disease is probably the most common chronic condition that needs medical management in older cats. The kidneys have a very large reserve, and we think about 75% in cats, just like in humans. That's why we can donate a kidney and still lead a normal life. But this also means that when we diagnose chronic kidney disease in our cats, that reserve has already been lost. This probably takes months or even years to happen, but what it means for us as vets is that we're working from a place where only a small percentage of the nephrons of the kidney are still working. So we want to do all we can to protect them. It is really important to know that treating kidney disease is not about regaining any function of the kidney. We simply cannot do that. Instead, managing and treating kidney disease is about protecting what is left. And it is about treating the consequences of kidney disease so that your cat can feel as good as possible for as long as possible. Let's talk about how to diagnose kidney disease in cats. In the early stages, cats may not show any signs of kidney disease. Sometimes they may drink or urinate a little bit more, but this is not always obvious to owners, especially if your cat goes outside. For this reason, it is important to have your cat checked regularly by a vet, as very subtle signs may indicate that something is not quite right, maybe a small amount of weight loss or a slightly poorer coat. Your vet may also be able to feel that your cat's kidneys do not feel normal. Sometimes they may feel larger than they should, and sometimes they can feel smaller. The only way to definitively diagnose kidney disease is to do both a blood test and a urine test. And ideally, you would do them together, as either alone may not definitively diagnose the disease, especially in the early stages. But together, they give a better indication of your cat's kidney function. In the blood test, your vet will be looking at something called creatinine. This is a waste product that the kidneys are responsible for clearing. An increase in creatinine may indicate that your cat has chronic kidney disease. With urine, it is important to check the concentration of the urine. Cats normally have very concentrated urine, as their kidneys are very well adapted to keeping as much water as possible in their bodies. A decrease in this concentration may indicate that your cat has chronic kidney disease. Neither of these parameters are specific for chronic kidney disease, but if tested together, there are no other diseases that will give the same combination of results of high creatinine and low urine concentration. So when these two are used together, a diagnosis of chronic kidney disease can be made. Prognosis depends on when your cat is diagnosed. Kidney disease is classified into 4 stages in cats. Cats diagnosed with kidney disease in the early stages of stage 1 and stage 2 can live for several years after diagnosis. Cats diagnosed in the later stages, stage 3 and 4, have a less good prognosis, which will also depend on any additional illnesses your cat may have. You should discuss this with your vet, and you can find additional information on the International Renal Interest Society's website, and I've provided the link for you on my website. There is so much to discuss with kidney disease in cats, and we have barely scratched the surface in this video. I have another video on treatment options. If you're interested in kidney disease, then I recommend you watch that, as well as a video that I have made about blood pressure in cats. If you have topics that you would like to see a video on, please let me know, and I will be happy to make one for you. See you in the next video.